Hi ladies, my name's Cheryl. I'm with Ultrasound Solutions. I am a triple board certified ultrasonographer or sonologist, and today I just wanted to talk to you guys about some anatomy and physiology and even some physics that go into vaginal rejuvenation and how that actually correlates with ultrasound. First off, if you're having urinary incontinence, even rectal incontinence, bile incontinence, they do recommend you do Kegels. So why do Kegels? What muscles do Kegels hit? Kegels hit 3 muscles of the pelvic floor. And when those muscles are exercised, they tighten around the urethra and also the rectum. The urethra is just superior to the vaginal canal, so just above it. When you give birth, or as we age, the vaginal canal is of course stretched and those muscles are stretched. And it's really hard to get them, the consistency back to the way it was pre-birth. Or as we age, our skin and muscles, they atrophy. And when that happens, that's when we start to have that trickle, or we cough, we sneeze, we run, and it's just like you have to wear a pad. So it's very annoying. Also, we experience that laxicity, especially after vaginal births or even with age. Even by the time you're 25, 30 years old, you're already experiencing muscle atrophy and skin atrophy. So when we do vaginal rejuvenation, when the probe is inserted into the vaginal canal, one important aspect of that is the cervix is actually not touched. So when the probe is inserted, the top of the probe has no type of device or is not emitting any type of energy. It's a 360-degree turn that treats the walls of the vagina and penetrates into the muscles. When you have the treatment done, it doesn't hurt, but it is equivalent to doing like 5,000 Kegels. So it's high intensity, focused ultrasound that penetrates into those walls and sends out those sound waves, not only penetrating the muscles, but also the tissues and the nerves that cause collagen regeneration and nerve regeneration. So if we look at our diagram here, I'm going to show it to you upside down so you can see it how you would see on your own body. So if we look closely here, this here is the rectal canal, this is the vaginal canal, and this is the urethra. So actually, let me turn it this way so that we can see. So if you lie down, this would be, if you lie down flat, the first hole that we would find in the vaginal orifice is the urethra, then the vaginal canal, and then the rectal canal. The muscles around here that experience the laxicity are the pubococcus, which surrounds actually the urethra, the vagina, and it goes all the way up. All these muscles are grouped together. The levator ani, which surrounds here, and the iliococcus, which really is around the vaginal canal and the urethra. When you have vaginal rejuvenation, those muscles are targeted because they surround the entire vaginal canal. The probe goes in and it actually treats in a 360-degree radius all the way out until we get to the end of the canal of the vagina, until we come out. And once that's done and those muscles are targeted, they start to tighten up. The collagen also regrows, which tightens those muscles up. So once those are targeted and tightened, that's how we achieve urinary incontinence. That's how we treat that. That's also how we treat vaginal laxity as well, because those muscles tighten, but not only that, you're growing new skin inside because of tissue heating. So I just want to show you guys also the probe. It looks kind of scary. Anyone who has given birth before, I'm going to say at least 95% of women, depending on your age, have had a transvaginal ultrasound. It's similar to that. The probe is slightly a little bit bigger, but it's definitely not as painful because we're not going to look for ovaries or looking at the adnexa, the sides of the pelvis inside of the vaginal canal. This is just a straight shot in and then come out. So I'm going to go ahead and show you the transvaginal ultrasound probe just so you can have a better idea. So this is a transvaginal ultrasound probe. And then it looks a little scary when you have ultrasound because the handle is very long. Most of this is just handle because we have to have room between our arm, the patient's legs, and we just need that space. So on this transducer, the crystals in the ultrasound transducer are on the end to give us that view, a coronal view. On the transducer for the vaginal rejuvenation, the high intensity focused ultrasound, there's nothing on the tip. Everything is on the sides. So only the walls are treated, which is very important also because if you have any history of cervical issues, precancerous cells, we don't want to mess with any of those tissues at the cervix. We only want to touch the walls. So that's what's great about FEM 360. Results I can tell you I had before I had the training done and I took and got certified to do it. I was experiencing that trickling feeling, the laxicity, things just weren't the same, and I've had 2 births. And a lot of people say, well, my babies weren't that big, it's not a big deal. My babies were actually, they were healthy, but they were small. So my babies were only 6 pounds, 7 ounces, and one of them was 5'11", my oldest. And nothing was wrong, she was completely healthy, that's just their size. But it's a baby coming through. So I definitely experienced some laxicity. It wasn't the same anymore. The urinary incontinence, I was tired of wearing pads, tired of worrying like, oh my God, let me not cough or let me squeeze my legs when I sneeze. Like, it's crazy. So we definitely as women don't have to suffer from that anymore with this treatment. And it's like brand new. Even if I'm coughing, if I'm running, whatever I'm doing, I no longer have that trickle. I simply wear a panty liner now, TMI, just because of discharge. This does increase the lubrication that you produce on your own. So if you have any dryness or it's just not lubricated as well as it was before and that moisture is gone, this treatment also helps with that intensely. Also, if you're trying to get pregnant, yes, we are tightening the vaginal canal. However, if you are trying to get pregnant and you have this done, it does increase that lubrication. And with that being said, sperm needs lubrication and a very moist environment to survive. It's a long way, it's a long swim from cervix to uterus to fallopian tube, which is where fertility occurs and fertilization occurs. So I actually worked with a fertility specialist and was an ultrasound and worked with IVF patients and did ultrasound guidance for embryo transfers. Along with that position, I also had to do some treatment work with them. So if you have any questions about fertility, I'm more than happy to answer those as I worked in that field for a while as well. So the next video we'll do is about physics and how the physics works with the machine. Take care, girls.